8 urgent diabetes symptoms in women you need to know. Act now to protect your health. Diabetes is a chronic, often lifelong condition that affects how the body processes blood sugar glucose. For women, the onset of diabetes, particularly type 2 diabetes, can sometimes be gradual and not immediately noticeable. Early signs of diabetes can overlap with symptoms of other conditions, which makes it crucial to be proactive in monitoring your health. Identifying diabetes at an early stage is essential for managing the disease and preventing serious complications such as heart disease, kidney failure, nerve damage, and blindness. In this article, we'll delve into the most common and often subtle signs of diabetes in women, focusing on how these symptoms manifest and why they shouldn't be ignored. 8 urgent diabetes symptoms in women you need to know. Act now to protect your health. 1. Polycystic ovary syndrome (PCOS) and insulin resistance. Polycystic ovary syndrome (PCOS) is one of the most common hormonal disorders among women of reproductive age. It is characterized by an imbalance in the reproductive hormones that can lead to irregular menstrual cycles, excess hair growth, hirsutism, and cysts on the ovaries. What many women may not realize is that PCOS is often linked with insulin resistance, a condition where the body's cells do not respond properly to insulin, causing the body to produce more insulin to compensate. Over time, this increased insulin production can contribute to the development of type 2 diabetes. A large body of research has shown that women with PCOS are at a higher risk for insulin resistance, which can lead to elevated blood sugar levels. In fact, studies have found that up to 50 to 70% of women with PCOS develop insulin resistance, and as a result, they have an increased risk of developing type 2 diabetes later in life. The hormonal imbalances caused by PCOS can also exacerbate symptoms of diabetes by encouraging excess fat storage, particularly around the abdomen, which further increases insulin resistance. Early detection of insulin resistance in women with PCOS is critical. Regular monitoring of blood glucose levels, maintaining a healthy weight, and incorporating physical activity into daily routines are important lifestyle strategies for reducing the risk of diabetes. Furthermore, medications such as metformin, which are commonly prescribed for managing insulin resistance, can help prevent the development of type 2 diabetes in women with PCOS. 2. Frequent or recurring yeast infections. Yeast infections, particularly recurrent ones, can be a major inconvenience for women. However, for women with diabetes, they can serve as a red flag indicating that blood sugar levels are not properly controlled. Yeasts, such as Candida, thrive on sugar. When blood sugar levels are elevated, the excess sugar is excreted through urine, creating a sugary environment in areas like the genital region. This provides an ideal breeding ground for yeast growth, which can result in recurrent and sometimes difficult to treat vaginal infections. Women with uncontrolled diabetes are more prone to yeast infections, particularly if their blood glucose levels remain elevated for extended periods. High blood sugar levels weaken the body's immune system, making it harder for the body to fight off infections. If you notice that yeast infections are becoming more frequent or difficult to treat, it's a strong indication that you should consult with a healthcare provider. Yeast infections alone may not indicate diabetes, but they can be a signal that warrants further investigation. Managing blood glucose levels through medication, dietary adjustments, and good hygiene practices can significantly reduce the frequency of yeast infections. Women who experience recurrent yeast infections should consider having their blood sugar levels checked as part of a broader health assessment. 3. Urinary tract infections (UTIs). Urinary tract infections (UTIs) are another common issue for women. These infections occur when bacteria enter the urinary system and cause inflammation in the kidneys, bladder, urethra, or ureters. In women, UTIs are particularly prevalent due to anatomical factors, but when diabetes is in the picture, the risk of developing UTIs increases significantly. Elevated blood glucose levels can cause glucose to spill into the urine, creating a perfect environment for bacteria to grow and multiply. For women with diabetes, this means they are more susceptible to recurrent UTIs that may be more difficult to treat. Additionally, high blood sugar can impair the immune system's ability to fight off these infections, leading to more frequent episodes. If you find yourself experiencing recurrent UTIs, or if UTIs are difficult to treat with conventional antibiotics, this could be a sign that your blood sugar levels are elevated. Research has shown that women with poorly controlled diabetes tend to have higher rates of urinary infections and complications related to them. It's crucial to address both the UTI and the underlying blood sugar imbalance to prevent further complications. 4. Skin changes. Acanthosis nigricans. Acanthosis nigricans is a skin condition characterized by dark, thickened patches of skin, often found in areas such as the neck, armpits, groin, and sometimes the back of the hands. These patches have a velvety texture and are often a sign of insulin resistance, a key feature of type 2 diabetes. The condition occurs when the body produces excess insulin to compensate for insulin resistance. This excess insulin can stimulate the growth of skin cells, leading to the characteristic dark patches. Acanthosis nigricans is not exclusive to diabetes, but is closely associated with it, particularly in cases where insulin resistance is present. For women who notice changes in their skin, such as dark patches in areas like the neck or armpits, it is important to monitor blood sugar levels. Early detection and intervention can help manage both the skin condition and the risk of developing diabetes. Acanthosis nigricans can be managed by addressing the underlying insulin resistance, often through lifestyle changes like diet and exercise, and, in some cases, medications. 5. Reduced sensation. Neuropathy. Neuropathy, or nerve damage, is a common complication of long-term diabetes. High blood sugar levels over time can damage the nerves, leading to peripheral neuropathy, a condition that affects the extremities, hands, feet, and legs. Symptoms of neuropathy include tingling, numbness, pain, and a reduced ability to feel temperature changes or touch. In women with diabetes, neuropathy can develop over several years of poorly controlled blood glucose levels. Early signs of neuropathy might include tingling sensations, sharp pains, or a feeling of numbness in the hands and feet. These symptoms may not seem significant at first, but they can progressively worsen, potentially leading to serious complications, including ulcers, infections, and even amputations if left untreated. The damage caused by neuropathy can be irreversible, which is why early intervention is critical. Managing blood sugar levels through proper medication, a healthy diet, and regular exercise can help prevent the progression of neuropathy and improve overall quality of life for women with diabetes. Additionally, medications and treatments specifically targeting neuropathy are available to help manage symptoms. 6. Persistent fatigue. Fatigue is one of the most commonly reported symptoms among women with diabetes. Chronic tiredness, especially after a full night's sleep, can be caused by several factors related to poorly controlled blood sugar levels. When blood glucose levels are consistently elevated, the body cells cannot efficiently use glucose for energy. As a result, even though the body has a lot of glucose in the bloodstream, the cells do not have access to it, leading to feelings of tiredness or exhaustion. For women with diabetes, persistent fatigue is not just a result of a busy lifestyle or lack of sleep. It can indicate that blood sugar levels are not properly controlled. Studies have shown that uncontrolled diabetes is closely linked to fatigue, and managing blood glucose levels can significantly improve energy levels. Women who experience unexplained fatigue, especially in combination with other symptoms like increased thirst or frequent urination, should consult with a healthcare provider to check for diabetes. 7. Blurred vision. Blurred vision can occur in people with diabetes when blood sugar levels fluctuate too much. High blood glucose levels cause the body to pull fluid from tissues, including the eyes. This can lead to swelling in the lens, affecting its shape and ability to focus properly. As a result, individuals may experience blurred or fluctuating vision. For many people with diabetes, these vision problems are temporary and may improve once blood sugar levels are stabilized. However, if blood glucose levels remain elevated for an extended period, the damage to the blood vessels in the eyes can become more permanent, leading to serious complications such as diabetic retinopathy. This is a condition where the blood vessels in the retina become damaged, potentially leading to vision loss. Women who experience blurred vision, especially if it comes and goes, should see an eye specialist and have their blood sugar levels checked. 8. Frequent urination and excessive thirst. Frequent urination, particularly at night, is a well-known symptom of diabetes. When blood sugar levels are high, the kidneys have to work overtime to filter out the excess glucose. This process causes the body to lose more water, leading to increased urination. To compensate for this fluid loss, the body signals a feeling of extreme thirst, prompting individuals to drink more fluids. This cycle of excessive thirst and frequent urination can be disruptive and uncomfortable. It's a signal that the body's ability to manage blood glucose levels is compromised. If this pattern becomes noticeable, especially when combined with other symptoms like fatigue or blurred vision, it's important to seek medical advice and get blood sugar levels tested. Conclusion: early detection and intervention are key in managing type 2 diabetes and preventing its long-term complications. Women, in particular, need to pay attention to the subtle signs that may indicate an elevated risk of diabetes. Conditions like PCOS, yeast infections, UTIs, neuropathy, and acanthosis nigricans can serve as warning signs that your blood sugar levels may be too high. By monitoring these symptoms and seeking medical advice when necessary, women can take proactive steps toward managing their health and preventing diabetes-related complications. Prevention is always better than treatment, and the best approach to managing or preventing diabetes involves a combination of lifestyle changes, including a balanced diet, regular physical activity, maintaining a healthy weight, and, if necessary, medications. Early diagnosis not only helps manage the disease more effectively, but also reduces the risk of complications that can impact a woman's quality of life. Women who recognize these early warning signs and act on them have a better chance of managing or even reversing the progression of type 2 diabetes. As always, consulting with a healthcare provider for personalized advice and appropriate testing is crucial in ensuring the best outcomes.